Good afternoon, everyone. This is Rob Waters, Program Director with State HIT Connect. Welcome to the October 8th State HIT Connect mini-series. Today's presentations are aligned to track 5 of our in-person meeting, the State Health IT Connect Summit, track 5 being State Marketplace Reform, Managed Care Optimization. We're very excited to host this morning's session, the opening plenary, transitioning to a state-based health insurance marketplace during a pandemic. We'll get to those all-important panelist introductions in just a moment. Next slide, please. I do want to just give a quick, I guess, shameless plug in and around our virtual meeting that is taking place December 7 till 9. The in-person program, of course, has been rescheduled for May 16 to 18, again in Baltimore at the Hilton. The virtual meeting that we will be hosting December 7 till 9 is a very exciting program and certainly a conversation of the time. COVID-19, respond, recover, and reimagine. Myself and my team have been interviewing with state teams from across the country around tactical response program, of course, and operations recovery efforts. And of course, very important, reimagine. Every conversation we're having at the moment starts with things will never be the same again. We'll be hearing a little bit about that, maybe quite not that harsh a statement from today's panelists as well. Yeah, very excited about that. There'll be more to learn. We'll be emailing out details. Next slide, please. Just a reminder, there are opportunities for sponsors for the meeting as well. These slots are filling out rapidly. Next slide, please. Today's session, you'll see here we have some fantastic panelists, very excited to bring together these groups, and I'd like to thank, of course, our panelists in terms of committing their time for preparations and spending time with the audience, State HIT Connect community today as well. And we're just going to go through quickly and allow these folks to introduce themselves, a very quick snapshot of who they are and how long they've been with their organizations. We'll get started with you, Ryan, please.
Sure. Thanks, Rob. I appreciate that. So my name is Ryan High. I'm the Chief Operations Officer for Nevada HealthLink, and I will also be the moderator today. I'm honored and looking forward to steering the conversation, posing questions, and asking states to respond to specific questions. Now for the introduction of our panelists. We'll start with Hannah, please.
Hi, my name is Hannah Turner. I am the Director of Operations for Penny, Pennsylvania's new state-based marketplace. And I have been with the organization for just about a year.
Great. Thank you, Hannah. Brent?
Hi, Ryan. Thanks, everyone. Happy to be with you today. Brent Ernest with BWell&M, which is New Mexico's health insurance exchange, and the path we're on is for a go live of October 2021. I started with BWell&M in January 2019.
Great. Thank you, Brent. As I mentioned, my name is Ryan High with the Silver State Health Insurance Exchange, or also known as Nevada HealthLink. I've been with Nevada HealthLink since October of 2016, and have been there during this transition period. We've recently had SBE. And now Venkat, please.
Hi, I am Venkat Koshnam. I'm the Chief Information Officer for the Maryland Health Benefit Exchange. I am with the exchange for the last 6 years. Thanks everyone for showing up today.
Great, thank you.
Okay.
And Rob, go ahead, please, Rob.
Slide.
That's great. So let's provide a bit of a background about Penny. This is Pennsylvania's state-based health insurance marketplace. If you can go to the next slide, please. So for some background here, Pennsylvanians have been purchasing coverage through using healthcare.gov since 2014, and are actually still through this current year using healthcare.gov to purchase health insurance marketplace. The Pennsylvania Legislature in July of last year, so July of 2019, did enact a state law to implement a state-based exchange. It was a bipartisan act, so we're very excited about that. In fall of 2019 was when we actually hired our very first staff members. We procured an IT and contact center vendor, and at that time we transitioned to an state-based marketplace on the federal platform. That's the SBMSP. What that does is it allows us to be able to get some additional data and a better understanding of our marketplace as we are in the process of that transition. So jumping ahead to right now, we are in this fall in the process of migrating our customers' data from healthcare.gov to the Penny platform for our inaugural open enrollment period on November 1st, about 23 days away from now. Our enrollment volumes are around 250,000 to 300,000. And I say approximately because prior to being an SBMSP, as a FFM state, we were for a number of years, there's limited detailed data that you can get. So we've been starting to understand our marketplace a lot better. However, we're really looking forward to becoming a true state-based marketplace with our own data and have a lot better insight into our marketplace. We, of course, like other marketplaces, do have a no wrong door approach to our application. So that does involve coordination with our Medicaid and CHIP agencies. We determine whether a customer is likely eligible for Medicaid or CHIP. And if they are, then we will send our applications to the Medicaid and CHIP agencies for that final eligibility determination. That's often called an assessment state. So it does require some coordination with our Medicaid and CHIP agencies for a smoother customer experience. Thank you, Ryan.
Great. And I just wanted to put this back to Ryan. I know you were going to do a little bit of context setting at the beginning of the panel. So did you want to talk through a little bit around the panel, or should we start just rolling through the introductions and get that out the way first, Ryan? How would you like to proceed?
Let's continue with the introductions, and then we can talk about the format of the session.
Great. Okay, perfect. So Brent, did you want to go next? That would be a good place to just get through these introductory slides, provide a bit of background for the organizational settings here.
Sure. So if you'd go to the next slide. Similarly, we provided a little bit of background about New Mexico and our history as a state with a state-based exchange. And so in 2013, our legislature established our enabling statute, the enabling statute that envisioned a state-based marketplace for New Mexico. Headed down that path and launched with just a shop exchange in 2014. Using the federal platform for 2014 with a plan initially to go to a full state-based exchange 2015. Ultimately decided not to do that, staying on the federal platform and becoming a state-based exchange on the federal platform, so an SBEFP, which is what we are today. In the fall of 2018, after watching the market evolve and thinking about the cost going forward as a state-based exchange on the federal platform using healthcare.gov, the board elected to pursue state-based exchange. And so we procured in the fall of 2018 a project management office, IV&V services, and in March of 2019 issued an RFP for a technology vendor. And then contracted for that and that summer. And we'll talk a little bit more about that, I think, later on. As you can see, we're the smallest market on the panel here. In 2020, our snapshot here is roughly 56,000 submitted applications through healthcare.gov. 50,000 were found eligible to enroll. 42, almost 43,000 of those made a planned selection. So it's not the effectuated number necessarily, but that's how many selected a plan. But we do have a pretty high retention and effectuation rate of that number. So it's probably pretty close. Of those, 37,000 are eligible for financial assistance and about 6,000 were eligible for Medicaid or CHIP. Similar to Penny, we will also be an assessment state. We are that today. So we'll be assessing eligibility for Medicaid for someone who applies through our exchange. And if they're likely eligible, transferring that application over to our Medicaid agency for a full determination. One of the things our board decided to do during this time period was actually extend our implementation period. So we were initially on the same timeline that Pennsylvania is on today, going live this year, but the board extended that timeline for another year. So we're about less than 12 months out now. But part of the reason was to create a more tightly integrated application process with our Medicaid agency. And so we've been working through that with our state Medicaid agency to really build out this no wrong door vision, leveraging a real-time eligibility service of our Medicaid program so that someone can arrive at health coverage in a single user session through either door. And so we can talk more about that if you have questions. And I think it's a little bit of background for what we'll be discussing throughout. So thanks very much, Ryan.
Ryan, did you want to go next?
Yes, that's great. Next slide, please. Great. So Nevada HealthLink, we started off as a state-based exchange for plan year 2014. And shortly afterwards, though, transitioned to a state-based exchange using the federal platform or this hybrid model of an SBEFP. And we operated that way from plan year 2015 to plan year 2019. And recently returned to being an SBE with 22 full-time employees and about a 50-person call center for plan year 2020. So Nevada HealthLink's end of open enrollment numbers for plan year 2020 were 77,410 across Nevada's 17 counties. And that broke out to about a little over 20,000 new consumers, 5,000 active re-enrollee consumers, and 31,000 auto re-enroll consumers. And our relationship to our state Medicaid agency, while close, is not integrated for purposes of determinations, but rather we're an assessment state, and we work in an assessment capacity, meaning that consumers coming in through Nevada HealthLink are assessed whether or not they are Medicaid eligible, and through an account transfer process are passed to Nevada's Medicaid agency for official determinations. And next slide for Maryland, I believe.
Thank you, Ryan. Unlike our other panelists, Maryland was started as a state-based marketplace back in 2011, and it's a public corporation and independent unit of state of Maryland government, and it's overseen by a board of trustees appointed by the governor. And as you can see on the right side bottom of the screen, we have a snapshot of our consumer portal. This is our bread and butter of our exchange, where consumers come and seek all the services. And talking about the services, we are a very tightly integrated system. We are integrated with the Department of Human Services and the Maryland Department of Health, our Medicaid agency as well. And our insurance determination is end-to-end, and we provide support. We provide determination and enrollment and support for Medicaid, qualified health plan, children's health insurance plan, and a recently evolving small business health option, and also family planning services insurance, along with standalone or combined dental insurance plans as well. Next slide, please. So I'd like to give a very quick overview of our technology. Over the years, we had really significantly evolved in the last 10 years from a barely functional exchange into a very robust cutting edge technology operated exchange. And there are four major components of the technology platform. Obviously on the top left, you can see the web application. That's where our consumers come and seek health coverage. And we have a very robust end-to-end mobile app called Enroll MHC. And interestingly enough, in the last couple of years, we are seeing more than 60% of our consumer traffic is going through the mobile app. And that's pretty interesting. And the reason is mobile app not only facilitates your preliminary eligibility or enrollment and plan shopping and all that, but also consumers can upload their documents, take a picture of snapshot of the documents that they need to upload for proof of eligibility requirement, and then right then and there they can submit the application. So that's kind of a functionality that we see really very well used by our consumers. And in the recent years, we have done significant improvement in terms of artificial intelligence. We have a chatbot called Flora, and Flora not only answers the typical FAQs, Flora is more and more becoming intelligent and then trying to support the consumers in many ways. I hope I can talk a little bit about it in our later discussion. And last but not the least, our Salesforce CRM is a very tightly integrated system with our exchange systems, where our call center workers provide all the support consumers need through the Salesforce system, which is very well integrated with our HP Axe Health Benefit Exchange system. We have around 2 million consumers overall, but out of which the active consumers are 1.3 million consumers in total, out of which 1.1 million consumers are from Medicaid. More than 150,000 consumers are currently opting for QHP. And obviously, as a system that have been in place for several years, we are hosting more than 24 million documents in MongoDB, and we have moved out of our legacy systems into more open source and latest technologies. Our database is moved from IBM into more Postgres and more open source technologies as well. And one of the things that we have improved recently is our renewal process. Our QHP renewal process, automatic renewal processes more than 99% of our consumers. So we renew more than 99% of our consumers. So that really relieves the pressure on the open enrollment period, where consumers generally come and do some plan shopping and make some changes to the information and things like that. And now we are going to the next stage, where how do we really excel in operations? How do we really engage with our consumers? How do we really how do we encourage retention of our consumers into the exchange? So we are exploring technologies, artificial intelligence and robotic process automation, and then integrating them into our daily operations and seeing more and more benefits. I hope we can talk more about this as well. With that, I will wrap up my overview. Thank you, Ryan.
Absolutely. Well, thank you everyone for providing that sort of organizational setting, and you'll hopefully the audience get an idea of what we're looking to achieve here in terms of, we have a real sort of spectrum of health insurance exchange implementation, right from those who are, in the sort of early planning stages due to, implementation stages, all the way through to the already established, more mature, leaning forward into some of those more emerging technologies through Maryland, and then those in between. And the whole idea for today's session is to really look at the operations, the functions and capabilities that a state needs to put in place when they're considering transitioning to a state-based marketplace, and to look at the different components of that transition process. And that's really what we're going to try and explore today, is to look at the critical planning considerations that need to be identified, and to really get input from the panelists as to how to address those factors, and for them to share their sort of lessons learned as well. So we're going to start this conversation around some of these key considerations. And Ryan, I think you're going to help guide this part of the conversation in terms of connecting us with some of the states and some of the conversations you've had behind the scenes that we feel would be particularly pertinent to address with the audience today.
That's right. That's exactly right. Thanks, Rob. So we've established 8 questions that will run through the life cycle to get started and set up a state-based exchange. These will run the gamut from establishment to standing up, vendor selection, continued success once you are an SBE, and then we'll wrap up with innovations at the end. So let's just jump right in now to the first question here. So how do states make the case to their respective states' legislature or government? And I'll start here with Nevada and kind of run through real quick a few steps of what we had to do to get established before we even went to the RFP section. So in Nevada, we met with staff with the Center for Medicare and Medicaid Services, CMS, and the Center for Consumer Information and Insurance Oversight, CISIO, in September of 2017 to explain our transition plan. As a state office, we made the case that I will detail in a moment that helped with obtaining buy-in from our governor's office. In Nevada, we're a biennial legislature, meaning we meet every 2 years, every odd year. So after we met with CMS and got that approval, we had to go to our interim finance committee in February 2018 for approval to move funding from reserves to spending categories, establish a transition. And what we did was we established a transition SBE category in our budget, an actual line item to accurately track expenses related to transition and becoming an SBE. And this has proven a really good idea, because if we ever get questions from legislatures, from the governor's office, we can go right to the slide item and find those exact costs for making that transition and becoming an SBE. We successfully made the case that even though we were planning to issue 2 RFPs later in the spring of 2018, one for eligibility and enrollment and one for the call center solution, and then separately soliciting contracts to stand up a project management office consisting of a project manager, 2 quality assurance specialists, a technical writer, and a training specialist, our case to the legislature was that the state of Nevada was still going to save money transitioning off of the FFM to becoming an SBE to the tune of about $20 million over 5 years. And having the flexibility of administering our own program, our own deadlines, our own extensions if we needed it, and then greater ability to use data, especially that granular data that we would get as an SBE. All of this helped in obtaining buy-in from the governor's office and our legislature. Those were our 3 main selling points back in 2018, and they still are today. Now, if Hannah, would you like to talk a little bit about your transition period and that buy-in you had from Pennsylvania?
Sure. So we did not have an exchange authority at the time. So this was the work of various folks within our insurance department and others who were really interested and saw the potential for a significant cost savings, and then the ability to take that cost savings from moving to an SBE and putting that back into our marketplace with a reinsurance program. And so that was part of the pitch to the legislature. That was why we were able to successfully, get that act passed in July of 2019. So our case was really about that as an SBE, we would have the flexibility to react to changes and serve Pennsylvanians the way that is best for them, and not just be forced to fit within a model that was determined by others. It would also give us a lot more local control for things like our in-person assistance program and education, communications, customer service. Then, of course, the decreased operational costs that would allow us to keep all of that extra money in our state and in our marketplace was really important. We projected that we'd be able to save in premiums, use the reinsurance program to save premiums by reducing premiums by about 5% in the individual market just by using that reinsurance program. Also, with the state-based marketplace, we'd be able to have foster a more competitive marketplace, have better oversight and management of our data, know what's happening with our populations. In particular, there's really difficult populations to track that, everyone's wanting to target, like Medicaid churn populations, some of the vulnerable populations that without having access to that data and the ability to know and really reach to those folks, it's really difficult to manage those. So that combination of things made the case for our legislature to bipartisan pass the act and let us move into become a state-based exchange.
That's great. That's great. Thank you for that. Let's move on to question number 2 here. All right, so we've established we got the buy-in from our governments. What kind of communication do states have with insurers and other stakeholders? We wanted to make sure we brought everybody along for the ride in Nevada. So we had early listening sessions in our transition to an SB with carriers, consumers, sister state agencies, and partners and navigator communities. So if I could ask Brent in New Mexico, what did your state do? Did your state do similar things? Do you have similar sessions? How'd you get that buy-in? And then when you're finished, if you could pass it over to Venkat to hear how Maryland did that. Oh, you're on mute, I think.
You're right, thanks. Yeah, happy to talk about that. And I'd point to 2 things. One, our board since inception really, and even in the enabling legislation, has a stakeholder advisory committee. So part of a formalized and ongoing process, we get feedback from a broad spectrum of stakeholders, from carriers to healthcare advocates and consumer advocates to brokers, about the operations of the exchange, about things they'd like to see going forward. So that was an important function for us. In preparation for the RFP, similar to the listening sessions that you described, Ryan, we held held stakeholder meetings really with this same set of stakeholders and grouped them. So a group of carriers, a group of brokers, a group of enrollment counselors, et cetera, to really learn what they felt was working with healthcare.gov and what they felt could be improved. So healthcare.gov has come a long way since inception. And so we knew there's some things that we didn't want to overlook, or some things we wanted to be sure might want to include in our state-based marketplace. We knew for many of the same reasons that you all have raised that we felt a state-based exchange was best for New Mexicans, including better access to data, lower cost over the longer term. But we didn't want to miss any of those things that we may not have been thinking about in terms of the experience people were having, how they interacted with healthcare.gov, and what happened if that application was sent to Medicaid, for example. So those sessions were useful for us in designing our RFP, and then useful for us as we think about being a state-based exchange. We also met with our Medicaid agency in advance of this, certainly, and the timing here was interesting as there's also a transition of administrations, new governor, new department heads, and new Medicaid director, et cetera. So as we were working on RFP, also working with them to figure out what their priorities would be. And then we continued that throughout this timeline, really trying to be as responsive to their work, and then what we want to achieve for that no wrong door vision that I mentioned at the beginning. So with that, I guess I turn over to Venkat, Maryland's experience.
Thank you, Brent and Ryan. Maybe I may want to answer slightly differently if you're okay, rather than talking about what happened to the Maryland in 10 years back. So maybe I can highlight what we are doing in the similar lines right now. In terms of operationally, in terms of running the exchange. We have a very active board, and our board is very diverse and very full of talented people, and talents from government at higher positions, and folks who have run private organizations, folks who have been part of healthcare from day one. It's a very exciting board. So our board is very active, and every month we have a meeting with the board except a couple of months, and board makes a lot of decisions, hears out in our initiatives. Decisions could be in terms of policy, in terms of technology sometimes, in terms of providing us all the support and funding that the exchange needs. So I would say that's the number one that we have. And besides the numerous public forums that our executive director and our policy director conduct regularly and interface with the state legislature and other public forums, that really serve as a very important feedback mechanism for the exchange. And we do obviously have several forums forums for issuers, and there is a advisory committee called Standing Advisory Committee. Again, it's a mix of a lot of talents from carriers and public. And we have a plan management steering committee, and there are numerous other forums run by, for example, specific to navigators, specific to consumer assistant workers and brokers. So all these are really a great feedback mechanism, as well as to give our value, seek feedback, as well as get buy-in from these folks. It's very important forums. And what we have is we work very closely with our sister agencies, our Department of Health, Department of Human Services, and they are part of our what we call as a work management group. And that work management group decides, prioritizes a lot of our initiatives, a lot of our policy implementations into the technology, into our exchange, etc. So overall, it is a pretty exciting group. We get support from top to the bottom to sideways, and then all these feed into very useful policy requirements, and then go into the technology and go into consumer service. So that's a great setup that we have.
Great. Thank you. I appreciate that. Moving on to our next question here. Selecting vendors. So we have buy-in from the legislature, we have buy-in from stakeholders. Next step, let's select a vendor here. So in Nevada, our initial work in selecting a vendor began in late winter of 2017, actually, where we issued a RFI, or request for information, to kind of see who the players were in the marketplace for both enrollment technology and in the cost center space. This was an informative process, and I'd recommend to any state thinking about transitioning, trying this RFI process first. Nevada then started drafting our request for proposal in the spring of 2018. We worked with our state's purchasing department in crafting the request for proposal, working on questions and answers while it was out there live before it closed, and then on grading and scoring. And along the way, we built in time for contract negotiations once a vendor was awarded, and we had built in time for state approval from Nevada's approval authority, Board of Examiners, who approves all state contracts, and then one more trip to the interim finance committee to approve for more funding for out of our reserves. So lessons learned real quick from Nevada: plan on extra/contingency time in any timeline you establish to initially create or transition to an SBE. And then Brent, can you tell us a little bit about how New Mexico's process went in selecting a vendor?
Sure. Yeah. Thanks, Ryan. And Nevada's experience was very helpful to us here. We initially followed right along after you all launched your exchange. We similarly issued an RFI, and as I mentioned, engaged in some stakeholder input for development of the RFP. So in the fall of 2018, after the board elected to become a state-based exchange in full, including the individual market, we procured a project management office that also was tasked with helping us develop the RFP. We procured the IV&V services, so independent verification and validation services, at the same time. And then in March of 2019, released the RFP for our technology vendor, which was and a call center operation. So we did combine those two and outsourcing the call center functionality. That was a single RFP, and ended up with a contract in August. So that's the timeline we operated under, from March to the end of August to full contract. Our current technology, our technology vendor we selected at the time was Hcentive, and they've now become a subsidiary of Optum. So we're working with Optum. They are subbed with NFP Health, who handles our call center operations and our premium billing functions. So one thing that's different in New Mexico is that we will also be assuming the premium billing and functions for the exchange, aggregating those premiums and then paying carriers. So that's a financial management system that comes along from NFP Health, and will be part of our overall implementation for a year from now. I think this, as you mentioned, I think ensuring you have the right time, assessing the market, in advance are all going to be critical factors, and really understanding, your procurement timeline is going to be critical. We had a transition from some broader procurement authority to moving in under the state's procurement code just after this procurement. So it's been a change for us. And I think understanding how long that takes an organization is important as you assess this task.
Great, thank you. And I'd be remiss to not mention that in Nevada, we also had to issue an RFP to select a vendor to work on a system-wide security assessment. And then I think Brent, also in New Mexico, you did this as well, but we stood up a temporary contracted project management office. As a small state agency, this was critical to us. And we hired a project manager, like I said before, 2 QA specialists. One was specialized in EDI and one was specialized in UAT testing. We hired a technical writer and we hired a training specialist. And we were pleasantly surprised when we recruited for these positions, the amount of experience that was out there nationwide in contract professionals that had exchange experience and that can really help a new state stand up their new SBE. So I know we're running a little bit behind on time here, so I'm going to go through these next few questions. We still have about 5 questions. I think they're really interesting. So we'll kind of speed this up a little bit here to allow for time for Q&A at the end. The next topic is about transfer of data from the federal system. So in Nevada, what we did, the steps we went through is, first of all, CMS delivered us test payloads for both application and enrollment portions of our consumer data migration. This was in early April of 2019. These test loads mimic precise data format that will be utilized in the production transfer that we had a few months later. Ourselves and our vendor, who is Get Insured, we're on track to complete the data migration by May of 2019. We had to make a go, no-go decision. This was really important for our carriers. They wanted to be super comfortable in the fact that the data transfer was going to be accurate. There were going to be no problems. And in May of 2019, we were looking good for open enrollment in November. A go decision was required, and we did meet that expectation for our vendors. So we had an initial data migration on August 15th of 2019. The platform was available for consumers to claim their migrated accounts on September 4th. So September was the first time consumers could go in there, and they had very limited options. It was basically claiming their accounts in September of 2019. On August 1st, we had a catch-up data migration for any SEP enrollments that occurred after August 15th. So remember, at this time, CMS was still our plan year or calendar year 2019 enrollment and eligibility platform. So any consumers that were still enrolling under an SEP, they had to, we had to capture that information and that data there. And then there was a second catch up on October 25th. So that way we had the most relevant information by November 1st. And then let's see here. I think, Hannah, you're gonna help with the second part of this.
Yeah, thank you. We are very fresh on this process currently in Pennsylvania. I think there were a lot of lessons that we learned from our colleagues in Nevada and took into account, I would say, for us, the biggest lesson was trying to find the right balance of making the data that we were getting from healthcare.gov as current as possible, while also retaining sufficient time in our project plan to allow for us to do multiple dry runs of all of our activities that we would normally do in advance of open enrollment, allow for us to dig into the data and validate, does this make sense where we're get multiple pools of data from the FFM. So we ended up doing our first production file from healthcare.gov in September, the beginning of September, and are doing also a late October catch-up file. In that process, that allowed us a lot of times to for the unexpected that comes along the way, to do those dry runs and validations, and to share some of our data with our insurers, which helps them to feel a bit more comfortable with where we were in that process. I would say the other piece, it was a lot of work to try to keep that broker and customer connection together in that transfer of data, but it was really, really important to us to maintain that relationship so that the customers who've been used to working with a broker would be able to continue to do so. That is part of it being a seamless transition. So really thinking that part through and planning for that early on, because it does add a bit of complexity to the process. And then the last thing is just planning to over communicate with our customers, our brokers, about the fact that if they're making changes on the healthcare.gov in this period right now, that we need to make sure that the systems get aligned and making sure that that is really clear. So that's been a really big part of our focus on communications from our initial go live through this open enrollment period. Thanks, Ryan.
That's great. Thank you so much. All right, moving on to our next question here. Open enrollment time, we want to communicate effectively with consumers, especially in the time of let's say this year in the time of a COVID pandemic, in alignment with other state programs. So in Nevada, we contract with a marketing and outreach vendor to assist with television, print, radio, social media advertising, collateral handouts, giveaways, and to assist with coordinating outreach events and earned media. Hannah, can you please start? And then Brent in New Mexico, can you please briefly describe your communication initiatives and any collaboration with other state agencies?
Sure, thank you. So at Penny, we did contract with a creative vendor and media buyer to help us design a media purchasing strategy that's aligned with our advertising and brand design to really reach Pennsylvanians where they are in a COVID environment. So, for example, since our residents are not commuting as much, we took any money that we may have otherwise spent on things like billboards and instead invested that in other areas for some sort of unique out-of-home advertising to try to find our customers where they are actually going. So we've gone from everything like from our grocery stores. So ads on grocery carts, hand sanitizer, the little 6-foot floor markers, places so we can get the word out. At the gas station, the videos that play for our customers at the pump. At home, we have designed door hangers that we can safely hang on the front door with a contact-free approach that puts the Penny logo, website, and our phone number literally on people's doorsteps. From the beginning, our brand was built with keeping diversity in mind, and that really is the bedrock of our brand. So we wanted to make sure that Penny we welcomed into the homes of our hard-to-reach citizens across the Commonwealth. And you know, hard to reach is often thought of as the inner city, but Pennsylvania has really large swaths of the population that live in deeply rural areas that don't have access to the internet. And we really did want to make sure that Penny could be used by all of our Pennsylvanians, regardless of their income, location, or language. And then we've also facilitated, with our sister network, we've added into that what we're calling our Penny Ambassador program, where those folks can help get the word out, and then as they find customers, you know, direct them to our sisters and brokers to get help, and they can focus on areas where there might be geographical or technological access issues for our Pennsylvanians. So. Thanks, Brent.
Sure. Yeah, thanks, Hannah. New Mexico, like Nevada, and sounds a little bit like Pennsylvania, also has a consolidated contract for outreach, marketing, public relations, really to be sure we have a consolidated and consistent message. You know, New Mexico is a big state, lots of rural areas, 2 or 3 big population centers, and we work closely with communities across the state, and there's a real focus on community outreach in our current contract and even in our one that's out for procurement now. Really, since the pandemic, there's been an increased effort to coordinate our messaging with our Medicaid agency and our insurance office and even the governor's office around the importance of health coverage, what the changes are in the laws and coverage for COVID and from testing to services. And that consolidated message really intended to emphasize, like I said, the importance of health coverage now and then also in the future. And so that's been an enhancement. I wouldn't say it's a major change, but it's certainly an enhancement over the last several months. We have developed and will be implementing a broader communication plan about the transition itself to a state-based exchange, and that'll launch next year. We'll maybe take some of Penny's ideas and use them too. So we appreciate hearing about those. The other thing I would mention is we do work with our state unemployment agency at company layoffs or other rehire events to provide information about health coverage, about what BULNM and what the marketplace can provide. And then we are working with our Medicaid agency around to understand churn a little bit better. So as folks are leaving the Medicaid program, to be sure they're getting the right information about the marketplace, about the exchange and what's available to them, including low costs or no cost, almost no cost coverage. So for those folks. So those are some of the things we are working on here in New Mexico.
That is great. Thank you. Thank you. Moving on to our next topic here, we'll talk a little bit about maintaining enrollment of existing marketplace consumers. Again, a little bit of time here to leave time for Q&A at the end, so I'll be brief here. So Nevada focuses on retaining enrollment of existing marketplace consumers through concept messaging, both pre-OE and during OE. We have opportunities for pre-open enrollment anonymous shopping and plan comparison, and we promote this heavily to welcome those returning consumers back to see, is your current plan good? Do we have any new carriers that might be in the marketplace you might want to look at? So forth. We have the ability to allow our consumers to select multi-year auto renewal selections, making this convenient for those consumers that really rely on the exchange and know they will for years to come. And then we, as a SBE, have the ability to extend, and we did actually extend the open enrollment, allowing existing marketplace consumers additional time to shop, especially we're going to January 15th this year. So especially past that holiday season there, where their focus may not be on selecting healthcare pre, but they will maybe after the 1st of January. And Venkat, if you could talk a little bit about Maryland's experience about maintaining current enrollees.
Sure, Ryan, thank you. And maintaining and increasing enrollments is a really very important goal for all the exchanges. And it falls in many folds, not necessarily in technology only. Our state reinsurance program is very successful. In fact, last few years, we have been consistently seeing premium reductions. And for the upcoming plan year 2021, our premiums are on average going to be 11% less than last year. So that's a very, very, very successful, very important initiative from our policy team. And for the marketing team, social media is a very big thing for the exchange. And our marketing team is very active in communicating with the consumers, print media, online media, social media, Twitter, Facebook, LinkedIn, YouTube, you name it. That's a very engaging feedback mechanism that we have. And from the technology point of view, we have built a marketing portal, which is integrated tightly with our health exchange systems, so that our marketing team can send out emails or text alerts or push notifications to the mobile app dynamically based on various life-changing situations of consumers. And obviously during open enrollment, before open enrollment, during a planned shopping period, prior to open enrollment, our marketing team can really leverage this tool to a great extent to reach our consumers. And like you said, Ryan, the renewal is really an important point as well. We currently have more than 99% of our consumers renewed into qualified health plan every year. So that's technologically, systemically, operationally is a great achievement as well. And we continue to evolve, and we always focus on how do we engage with the consumer through technology. Our mobile app, our Flora artificial intelligence chatbot, all those things really help us. And we also have several upcoming initiatives. There is already an initiative called Maryland Easy Enrollment option, where we integrate our systems with the state tax authority. At this time in the phase one, we are getting data from the tax authority to see if we can automatically determine some consumers for eligibility. And in the upcoming phases in the next couple of years, we are going to very tightly integrate with their systems as well. And also we are beginning to work with our Department of Labor to seek data from unemployment insurance customers. And hopefully we would be able to preemptively hopefully provide some coverage when they really face the situation of unemployment at a very difficult time. And besides technology, obviously the navigators and the consumer assistance workers and brokers, they're all really significantly important part of the exchange in order for us to retain as well as enhance our enrollments. Back to you, Ryan.
Thank you very much. Moving on to our next topic here real quick, addressing data matching issues. So in Nevada, we have built-in logic to address data matching issues concerning various checks. If these cannot be confirmed or there are discrepancies, proof will be required from the consumer that can be sent or uploaded to our call center staff. There are resources that will help verify this. Venkat and then Brent, if you could please briefly describe your state's process to address data matching issues.
Yes, thank you, Ryan. As you had noted, the end-to-end verification is an integral part of the exchange. We do verify the income through the hub, federal hub, and also the state labor department income data as well. And also we have several interagency verifications that we run through batches to cross-check income as well. And as I had noted earlier, the mobile app is a very significant component for consumers to quickly submit a document, take a picture of your document that you want to submit and upload it into the system. So that's a very important part. And we are also going into the robotic process automation. In fact, we have implemented recently an RPA solution that automatically verifies the biographic data of what we have with the exchange with other sister agencies. And this automation actually reduces more than 10,000 transactions that are performed manually every month. And now we are working in looking into the optical character recognition technology. And our hope is we plan to implement early next year to automate the verification documents, hundreds and thousands of income documents that consumers are required to submit if any of those automated verifications fail, and the bots can come in automatically verify those documents, thereby reducing the enormous amount of manual labor and also significantly reducing the time it takes for consumers to get the results from the exchange. And down the line, definitely we will be making it a more real-time document verification through our AI technologies, and those are in place. And recently we have also implemented several electronic attestations, specifically on affidavits of no income and things like that, where consumers don't have to print an affidavit, sign it, send it to the call center, and have it verified. So these initiatives not only save thousands and hundreds and thousands of documents and manual labor associated with it, but also significantly reduces the consumer's time or wait time to get the service, as well as increases the program integrity great way. Back to you, Ryan.
Great. And Brent?
Sure. Like all state-based marketplaces, we'll have a connection through the Federal Data Services Hub for the verifications that we need to do of application data, right? From income through IRS to citizenship and other services, Homeland Security and the SSA. And that interface will, hopefully we'll be able to leverage those quick connections to get to health coverage without having to send, the requests for information, as we call them here, when there's a data mismatch. When there is, we'll both send a paper notification and an electronic one when someone's able to opt in for that, for both either a notification that they have a notice in their secure inbox via text or via email. And then they can resolve that request for information by providing those proofs to us, either via uploading information, even if it's a picture, or uploading a document. So we'll be leveraging that functionality when we launch our exchange. The only thing other thing I would mention here for states to consider as they do this is how they exchange that kind of information with their Medicaid agency. So verification is similar in the Medicaid program as it is in the exchange, but the rules are a little bit different in how you can use it. So we've worked to try to develop a process that avoids, or at least limits, the times we're asking for the same information from a household that the Medicaid agency will be asking for. So we're still working on that, still some work to do, but I think it's an important issue for from a consumer perspective, and so to avoid confusion, really to just be asked for some piece of paper only once, or be sure it's a very direct ask. So it's something we're working on as well.
Great, thank you so much. And I see we have about 4 minutes left in this session. So we spend maybe 2 minutes. I'm going to ask Venkat, the most seasoned state on the panel here, to talk a little bit about innovation, leading edge innovation. And then if we can leave 2 minutes for questions and answers at the end, that would be a great way to wrap up this session. Venkat?
Thank you, Ryan, appreciate it. So over the years, the exchange has built its technology very robustly and operations very robustly as well. And the way our teams are structured and the way we are able to rapidly implement policy changes, policy requirements, and system enhancements, that really helped us, especially during this pandemic. And we implemented a COVID-19 SCP very rapidly within a day's notice from the governor's office. And we are seeing tens and thousands of consumers enrolling because of this SCP. And from the technology point of view, our exchange is on AWS Cloud right now. And last year, we had completely revamped our consumer portal into a more responsive site. And not only changing the technology underneath, but also in terms of enhancing the user experience. The kind of questions that we used to ask, how do we change it, make it very simple? And those are the changes we really did. And again, like I said, robotic process automation technology is really a big thing for us this year. And we are trying to implement everywhere in our transactional flow, whether it's a Medicaid transaction or it's a QHP transaction, sending it to carriers before verification. We are asking the bot to do the validations as opposed to somebody physically validating those data. And also in terms of security, we are using bot to do the system health check all the time. And also from audit and compliance side, we do want to ensure our determinations are accurate and stands the test of time. And we are working towards that. Hopefully by next year, early next year, we will be implementing those as well. And again, artificial intelligence technology is a big thing everywhere. And we started with a small chat bot, and now chatbot Flora is a little more intelligent and getting more and more intelligent every day. And our goal is to integrate the chatbot into our eligibility enrollment flow, where consumers can have seamless user experience through conversations, can get the enrollment done. That's a very important thing. It's very hard to complete eligibility or enrollment determination for seeking health coverage. This is worse than the tax filing taxes. So we do need to support through technology so that the consumers can do these things easily. And our OCR, optical character recognition technology I talked about, is a big thing as well. and we will be doing our mobile app revamp in 2021. It's been 4 years, and we would like to use the latest technologies, providing a lot of information pre-login to consumer. When they open the app, before even they log in, we can give certain information. Maybe we can give a Medicaid ID card in the mobile app itself for the verified devices and things like that. And we are expanding our small business exchange. Hopefully in the next 2 years, we'll be doing that. And there is a huge initiative we kickstarted in terms of business intelligence reporting. We are using the ClickSense tool to automate a lot of our reporting through intuitive dashboard, as opposed to sending hundreds and hundreds of reports every month to various agencies, organizations to facilitate determination. So these are some of those ideas, and thank you for listening to those ideas.
That's great. That's so great. Thank you. And Rob, it looks like we're just about out of time. I don't know if we can get the Q&A, but I wanted to offer, if any of the listeners or any of the attendees have questions, I'm more than happy if you want to offer my work email to get back to people, but I'll turn it over to you now, Rob.
Thanks, everyone. Thanks for all of the insights. I just want to do a quick round robin. We probably have just 1 or 2 minutes just to add some on to this, and I'll get to a couple of the audience questions. One is just relative to the security frameworks. Is compliance with MARSI an issue, and how do you address that? We'll just do a quick round robin. Hannah, you're about to launch and recently probably been through a lot of these compliance initiatives. Do you have any thoughts on that?
It's important. We have to get that up, that MARSI 2 certification. So.
Okay, Brent, do you have any comments on that?
Sure. As I said, yeah, it's important, required for all exchanges. I think in particular, the security around IRS and the SSR requirements that we have to file will be a significant amount of work. Potentially bringing on additional security contractors, even as Ryan mentioned. So a lot of work there, something for states to think about.
Sure. Ryan, Venkat, any additional comments beyond those that have already been made?
No, just real quick, I would say that the amount of work in establishing those, going from an SBMFP to an SBE, was a lot of documentation, a lot of publication of documents to make sure that we're showing that we're meeting those requirements. That's all I would add, is the amount of work put into those types of documentation.
Yeah, I would like to simply add that it is worth it rather than just meeting the requirements. We are compliant, and we are looking into down the line, potentially we may have to become HIPAA compliant if we are talking about handling personal health information document for our Medicaid agency. So I would suggest that the agencies can really use this requirement to really enhance beef up their security.
Great. And then just some final comments. Obviously, we've just recently been through a very sort of turbulent time with the pandemic, and that has demonstrated a lot of churn in the labor markets, and I'm sure a lot of churn coming through the exchanges and government programs as well. Overall comments. What is have your states experienced in terms of some of the advantages transitioning to state-based marketplace? And how do you think it's put your states in a potentially beneficial scenario relative to serving the needs of your citizens? And we'll start with you, Hannah.
Yeah, I think we were hoping that the federal government would issue a step this year for COVID, and they did not. And we didn't really have the authority to do that, which was disappointing. So I think we saw other states doing things that we were not actually able to do yet, given that we were still on the federal platform.
Sure, Brent.
Yeah, I would echo that. I think it highlighted the fact that we don't have the flexibility we need to respond to in the pandemic, and so we too wished we could have done more during this in the last year, and looking forward to that flexibility and understanding our marketplace better as a state-based exchange, full state-based exchange. Ryan,
you're obviously in your first year of implementation. Do you look in the rearview mirror? Do you feel like Nevada is really in a better place?
I do. And if there was any year to do this transition, it was this year, because we were able to take advantage of that SEP, that exceptional circumstance SEP, in the April-May timeframe here in Nevada. And not only that, our board was able to approve an additional SEP at the end of our OE. So technically we had the federal OE until December 15th. And then we have what we're calling a market stabilization SEP from December 16th to January 15th. It'll be seamless to consumers. They'll just see an extended OE, but that gave us, being an SBE this year, it gave us that flexibility to extend that OE.
And Venkat, obviously you've been in SPM for a longer period of time, or in fact a very significant period of time, 10 years I think you're coming up to. So again, just looking at your situation, how do you reflect on some of the flexibility that Maryland has been able to provide, and coordination with your agencies, your Health and Human Services agencies?
Yeah, absolutely. This is a very difficult, if not impossible time. And thanks to the flexibility, because Maryland has this, because of being a state-based marketplace. And because of this flexibility, we were able to react very rapidly to implement a COVID-19 SCP. And in fact, we extended multiple times. The board was very rapid in supporting that as well. So the flexibility really gave us the agility to provide the real support that consumer needs at this time. So we are very thankful for that.
Okay, folks. Well, look, I know we've gone a little bit over time. We do have prep ready to do for the 1:30 to 2:30 Eastern Daylight Time session, and that is entitled Turning APCD Data into Action. A very exciting conversation there, obviously looking at some of the investments states have made in APCD, potentially new approaches, and how those data repositories can be leveraged in terms of actionable insights. So do stick with us. That session, as I said, will be starting in just over 20 minutes at 1:30 Eastern Time. Thank you, Ryan, Hannah, Venkat, Brent. Thanks for sharing your insights. I'm sure more conversations. Do email us your additional questions, and we will get those out to the panelists additionally for their input. Thank you, everyone.
Thank you.